The Humanitarian Program Cycle, or HPC, is a sequence of 5 steps used by all sectors, which aligns with Standard 4 Program Cycle Management in the minimum standards for child protection in humanitarian action. Each HPC step builds on the next and includes needs assessment and analysis, strategic response planning, resource mobilization, implementation and monitoring, and operational review and evaluation. The first step is needs assessment and analysis. You might have heard of the Humanitarian Needs Overview, or HNO. This is the needs analysis across all sectors of the humanitarian response. For child protection, needs assessment and analysis is about ensuring that programming is based on evidence about the geographic area and population groups with the most child protection needs, the most significant child protection risk factors and protective factors, the underlying drivers of violence against children, and the existing services available in affected communities. To coordinate an interagency needs analysis, the Child Protection Area of Responsibility, or CPAOR, uses the Needs Identification and Analysis Framework, or NIAF. The Needs Identification and Analysis Framework has several benefits, including minimizing the need for new data collection, sharing workload and resources, generating shared learning through joint discussions and analysis, and building collaboration between child protection actors and across sectors. All humanitarian child protection organizations should contribute to interagency efforts to assess and analyze needs. A needs analysis can involve collecting new data through a needs assessment. But first, it is essential to review existing information and identify any gaps. Some useful sources of secondary data include national, administrative and prevalence data, response level data, and project data. In addition, child protection actors can make good use of indicators collected by other sectors such as education, health, and food security and livelihoods. Only after secondary data review is it possible to decide if a needs assessment is required.
After 3 decades of conflict, there are 5.2 million people in need of humanitarian assistance in Somalia.
In August 2019, we worked with the NIAF team and an organization called REACH to use existing operational and prevalence data to understand the situation.
We were able to use the existing data to estimate the number of unaccompanied and separated children and the number of children associated with armed forces and armed groups.
Across the CPAOR, national NGOs and government actors were active in participating in joint analysis interpretation sessions
to prioritize the location with the most severe child protection needs.
By working together, we were able to get services to the most severely affected communities
quicker than if we had started gathering new data.
In some situations, after conducting a secondary data review, it might be necessary to conduct a needs assessment to gather additional data to fill the gaps. A needs assessment can take lots of different shapes depending on the context.
At the end of January 2020, there was an increase in fighting in Yei, South Sudan. The conflict displaced a lot of people, including lots of unaccompanied children. We did a child protection rapid assessment because we were dealing with the new situation and we needed to act quickly. A small team went to Yei to interview local chiefs and women leaders and to do focused group discussions with the girls and boys. Afterwards, we produced a 5-page report that could be read quickly. By doing the child protection rapid assessment, we were able to confirm how many children were in need in Yei, including the estimated number of unaccompanied children, girls at risk of sexual violence, and the boys at risk for recruitment into armed groups. With this knowledge, we were able to respond accordingly and to get extra funding from donors.
Iraq has a long history of conflict. Each year, a multi-sector needs assessment or MSNA occurs. The MSNA works in Iraq because the situation is relatively stable. The humanitarian response is well established and well coordinated.
Usually, a data collection team visits households with a survey. However, this year, because of the coronavirus, data collection will be remote.
In areas more affected by COVID-19, household surveys will be conducted by phone interview. The findings will be compared to existing secondary data, such as information from other sectors. The severity scale will be used to calculate children in need.
We will also conduct a series of joint analysis and interpretation workshops at national and subnational levels to discuss the data.
The results will be used to write the HNO, which informs the humanitarian response plan for the child protection sector.
As can be seen in the examples from Somalia, South Sudan, and Iraq, the key to a successful needs identification and analysis is to select an approach that matches the situation in your context, and to ensure that a diverse range of local, national, and international actors play an active role in needs assessment and analysis.